going to be with state budget.
We need to have also information on the labor market.
So a major component of this workshop was, of course, to explain and to teach the assessment-based national dialogue methodology. The objective of the assessment-based national dialogue is to know whether the social protection floor is already a reality in the country.
And we actually compare the existing schemes with the social protection floor, or the desired level of social protection floor.
So what we do is that we build a matrix, which we call the assessment matrix, where we list all the social protection schemes existing in the country for the 4 guarantees: for access to health care, for income security for children, income security for the working age, and for the elderly. And then in columns we have, the first column is what are existing schemes in the countries. And then the second column is what is the legal framework and who do they cover, and what are the levels of benefits, the level of coverage that they provide, etc. And then we have more the description of the schemes. And then we have a column where we try to identify if some parts of the population are not covered, or some benefits are not sufficient. This, we call it the design gaps. It means that in the legislation, in the system as a whole, there is a hole, there is a gap, and we should try to fill this gap. And then we have a column calling implementation issues, where we try to see for different schemes, even if they exist, maybe they don't function well. And then in the last column we have a column to write the recommendations. And so then, based on this work, we come up with a number of recommendations that will lead to policy formulation.
And then the recommendation can be costed. Some of them can be costed, not all of them, of course. And based on the costing, then we go further to discussions whether it is possible or not, whether it is desirable, and which ones we should prioritize.
For that, we need to ask ourselves who will be covered. Will we cover everybody, or only the poor, or the not so poor, or people in rural areas, people in urban areas with different packages? Then what will be the benefit package? For instance, if we are talking about a child allowance, so it's an amount of money that the family will receive every month to facilitate many different things, like the fact that the child will be able to go to school, to have access to proper nutrition, etc. For the costing of the policy options, we are using an ILO tool called the Rapid Assessment Protocol, which is based on several spreadsheets. So we have a first spreadsheet on the population data and population projections, another one on the active labor market information, another one on economic indicators, etc., and one also on the government budget. And so we have first to fill all these spreadsheets, and then once this is done, we for each of the policy recommendations, we propose a number of scenarios. So, for instance, if we want to advocate for a child allowance, we can have one scenario promoting a child allowance of 400 baht per family or per person per month, another one of 500 baht. One scenario could target only the very poor children, another one could target also the near poor children, another one could target all the children in the country. So you see, we play with different scenarios. It's not very difficult to calculate as many scenarios as we want. And in the end, we come up with a cost per person per year, and we project this cost across the years, so that we can have a cost projection of the new policy that we want to implement. And third step is to try to engage in a discussion with higher level officials at the ministerial and the ministry level or deputy ministry level to explain the process, explain the recommendations, explain the results of the assessment exercise, and to have their support for the launch of the report, and further to the launch for the implementation of some of the recommendations.
So there's a lot of process in getting all the different stakeholders together, and I think that's the most, at one side, most challenging, and on the other hand, also the most rewarding, because that way when you engage all the stakeholders, you know that their endorsement will help us get to achieve better social protection for